Welcome to this NEJAC conversation on cumulative impacts protecting people, not just permits. My name is Aya, and
my name is Jimena.
And we were council members of the now canceled NEJAC, the National Environmental Justice Advisory Council, and now I'm part of a project called NEJAC Media. Our goal is to bring the NEJAC recommendations back into the public eye. The NEJAC was a federal advisory council formed in 1993 under the EPA, the Environmental Protection Agency, to advise on all things environmental justice. So we did it for over 30 years across administrations until recently. You can Google NEJAC recommendations to find these recommendations. Today we're exploring one of the most important shifts in environmental justice and public health, how we measure and respond to the whole picture of what communities actually experience, cumulative risks and impacts. For too long, our systems have treated pollution sources and social stressors as separate issues, as if a smokestack, a freeway, and a lack of health care all exist in isolation, but people live at the intersections of these realities. Cumulative impact assessment recognizes that intersection, that health, dignity, and justice depend on understanding how multiple burdens combine over time to harm or heal. In 2024, the National Environmental Justice Advisory Council, NEJAC, released a landmark report on cumulative impacts, nearly 2 years in the making, after deep consultation with communities, scientists, and agencies. These recommendations, summarized in fact sheets by the Union of Concerned Scientists, call for a fundamental shift in how EPA and other parts of government measure risk, accountability, and responsibility. Today, we're joined by Dr. Kristie Ellickson, Senior Scientist at the Center for Science and Democracy at the Union of Concerned Scientists, and co-chair of the NEJAC's Cumulative Impacts Work Group. Kristie's work focuses on bringing the science of cumulative risk and impacts into real-world regulatory decisions. Kristie, welcome, and thank you for joining us.
Thank you. It's such an honor to tell this story. So thank you for having me and doing this work.
Absolutely.
So, Kristie, you worked on cumulative impacts in Minnesota and across the country. How did you first get involved in this work, and what did you learn about how communities actually experience multiple stressors at once?
Right. Thanks for the question. So I've always been interested in how trace and toxic chemicals travel in the environment, how they might enter our bodies, and what happens once they get into our bodies. And I was lucky enough to be assigned to work on the first cumulative impacts law in Minnesota back in 2011. I was a scientist working for the state of Minnesota at the time at the regulatory agency there. And I was assigned to co-develop how we would analyze and consider more than one chemical at a time. So instead of a facility kind of being treated in a permit as kind of an island, we had to consider the host community around it. And so one of the things I learned is comes from one of the activities we built in that early process for analyzing and considering cumulative impacts. We required that that information sessions be held right at the beginning of the process. And so that was an incredibly helpful way to sit folks like myself who knew about how air pollution moves and how it might transform with folks who knew the ins and outs of their community. And that helped match our analysis with the community better. And that's kind of fundamental here. So yeah, that's how I came about this work.
And looking back, NEJAC first convened a cumulative impacts work group in 2004. Two decades later, the issue is back in the center of national attention. How much progress have we really made since then? Do you feel like the 2024 recommendations build on that early foundation, or are we still fighting to be heard from the same point?
So yeah, there's a lot of different ways to answer that question. But first of all, since NEJAC wrote recommendations in 2004 on multiple exposures and cumulative risk to now in 2025, there's a lot more science. In fact, this week, the National Academy of Science, Engineering, and Medicine published a cumulative impact state of the science report, talking about cumulative impacts, the state of science, and in it, my perspective and listening to their webinar yesterday is they called these cumulative impacts mapping methods mature, which is a big deal. That said, on a federal level, there is still a lot of work to be done to solidify methods of analysis and ensure that those results from those analyses are used in decision making, tracking to that they actually have outcomes in reducing pollution and reducing those gaps in pollution that we see. So right now, there's a lack of progress in the federal government right now, but states and cities are leading the way in this space. And there are laws that have been passed since 2004, when the first cumulative impacts NEJAC recommendations came out, to ours in 2024. States and cities are leading the way in this space with laws passed in, I'm going to leave some out, not intentionally, but like in New Jersey, New York, Massachusetts, Minnesota, Colorado, California. There's strong bills that continue to be introduced in states like Maryland and Michigan, and cities, for example, Washington, D.C. and Chicago are working on bills and ordinances. So there is some progress, but that progress, when it's in states and cities like that, isn't going to be felt throughout the nation. And we need federal government action so that we all get the safe environmental protections that come along with cumulative impacts laws and rules across the United States. So, and I have, none of this ever would have happened without, none of this progress would have happened without the long work of communities advocating for equal environmental protection, which is environmental justice. So, yeah.
Thank you for that comprehensive answer. That really gives us a good view of how things have progressed through the years. Now we're moving to a question about defining cumulative impacts in practice. The first recommendation in NEJAC's 2024 report says EPA should use cumulative impact assessments to reduce disproportionate exposures and impacts in overburdened communities. That sounds powerful, but what does a cumulative impact really mean in practice, not just in theory, but in the lived experience of a neighborhood?
Right. Yeah. And so for a long time, some communities have been treated like sacrifice zones. There are more heavily trafficked roads in some communities, more polluting facilities, more areas that might, require cleanup from contaminated soil. And those areas also tend to be areas that are historically disinvested, so might have less safe and healthy infrastructure, like safe places to recreate, exercise, less to no grocery stores, less access to culturally competent healthcare centers, local healthcare centers, that kind of thing. And honestly, so that's the experience is these interacting stressors and burden. By stressors, I mean something that could adversely impact health. And there's pushback against cumulative impacts policies saying that environmental agencies don't regulate these social adversities, but we need an environmental protection system that regulates in light of and acknowledges and doesn't ignore that this is people's reality, and this is this idea and this experience of people's reality occurring, together with pollution exposures is evidence-based. It's based in science, it's based in fact. So we can't keep compartmentalizing, toxic chemical exposures in our environmental system, or we're going to keep perpetuating the fact that some communities are more exposed and overburdened than others.
Thank you.
Thank you. So let's talk about what's working. Can you share a real world example where cumulative impacts thinking has led to tangible change, maybe in cleanup, permitting reform, or public health outcomes, and how were those results measured? And could these models be scaled nationally?
Yeah, so I'll talk about nothing's perfect, first of all, but I'll talk about two examples of where cumulative impacts consideration is used in government decision making. So California is an example where they developed a map that uses multiple types of data that incorporate different stressors and burdens, and they look at where those stressors and burdens overlap in space. And they use that information where there's more stressors or there's more overlap to move resources and programs and money based on this data. And that's a data informed decision. Um, and so, and that's a way to do effective governance. But again, nothing is perfect, And anyway, another good example is New Jersey has a law and now regulations in place where they again look at mapped and multiple types of data, and they look at these stressors, this stressor data one by one, whether or not each of these stressors is higher than an area in New Jersey. So where that facility might be permitted, are the stressors in that area already higher than another area in New Jersey? And if that permitted facility would add to those stressors that are already higher, then there's more regulatory authority to deny condition that permit, to limit that permit or deny it. And that's important. And they're just starting in the actual implementation of that permitting structure. In the state of Minnesota, we had that earlier law. It was really early in all of these mapping efforts. And one thing we found is we had kind of a tiered approach to analysis where you had to do more and more analysis depending on your potential to impact health in a community. And facilities would take permit limits to avoid more analysis. So that was kind of one way we got to reduce pollution ahead of time, So those are multiple methods, denying permits, limiting conditioning, taking limits ahead of time, moving resources to where they're needed most. And all of that can be informed by multiple types of data under that, that cumulative impacts umbrella type of thing. Yeah.
Thank you for that. So cumulative impacts aren't only about pollution, it's about the conditions that shape health, right? So could you walk us through the social determinants of health and how they interact with environmental exposures?
Yeah, they're super important. So social determinants of health are non-medical factors, and in our field, we would include, non-environmental pollution factors that influence our health. So this is about our surroundings and factors in our surroundings that lead to our ability to lead healthier lives. For better or worse health for all of us, depending on those social determinants of health. So one way I describe it, for example, is say someone lives in a community with multiple pollution sources, let's say maybe a power plant, data center, foundry, asphalt plant, things like that, and say that it is not safe for them to recreate easily outside. Maybe there aren't sidewalks, maybe there aren't lanes where they can get away from traffic in their neighborhoods. So if you're not able to recreate and exercise outside, that's going to affect your cardiovascular health, your heart and lungs. If you're exposed to pollution, that's going to affect your heart and lungs too. So they both act in concert, but also one thing makes another thing worse. So if you're not able to be active and help your heart and lungs be healthy, that pollution exposure could be worse. So there's different ways all of these things interact. Yeah.
Thank you for the thoughtful answer. People sometimes assume we need new laws before anything can change. But what tools does EPA already have under existing statutes to start using cumulative impacts assessments now? Where could the agency act faster through permitting reform, community-based science, or Justice 40 implementation without waiting for Congress?
Right. And I'll answer that question using two laws. So there are phrases in existing federal laws that allow environmental decision making that is inclusive of some of the factors we've been talking about. For example, the National Ambient Air Quality Standards. National Ambient Air Quality Standards set levels in the air of 6 air pollutants. And if in a location, if the concentrations of those pollutants are higher than that standard, something must legally be done. Again, the National Ambient Air Quality Standards. And those National Ambient Air Quality Standards are required to be developed using an adequate margin of safety. So, for example, in 2024, the American Lung Association wrote a piece describing how that adequate margin of safety needs to include some of these other stressors and burdens that we talk about in the cumulative impact space. So the fact that people are exposed to more than one pollutant at a time, climate change impacts like extreme heat can impact impact your reaction to pollution exposures, et cetera. Socioeconomic factors that put up barriers to your resilience and your access to healthcare, et cetera. So another example is this country is required to reduce risks to toxic chemicals under a law called the Toxic Substance Control Act. And there's a requirement in that law to use the best available science. So there is so much science providing evidence that communities of color and lower income communities are more exposed than their whiter, wealthier counterparts. And there are copious measurements in people and in the environment of more than one pollutant at a time. And that right there is the best available science in this case. And so must be considered when decisions are made about exposing Americans to toxic chemicals. So in addition, we'll just kind of finalize. This is a long answer, but I had the honor, like we said earlier, of working with the NEJAC to co-develop these recommendations. And these, so they exist, and they exist as recommendations from an advisory board to the EPA. They are on the Federal Register, and they went through public comment, et cetera. So, and again, just to reiterate, the NEJAC is a federal advisory committee. It brings a lot of diverse voices to the table. In writing those recommendations, we had lots of conversations. We tried to make sure that everyone's ideas and voices were reflected in those recommendations. And that said, it's a well-cited, long document. So in order to make it more accessible to folks, the Union of Concerned Scientists wrote a series of fact sheets. I believe there are 8 fact sheets. They're on the Union of Concerned Scientists website. There's one fact sheet for each of the themes of the NEJAC recommendations. And the NEJAC recommendations were broad. One of the themes were disproportionate or unequal impacts. There was one theme around lived experiencing, capturing lived experience. And there was a whole theme on how to actually do cumulative impacts in existing work. So how to incorporate cumulative impacts into the ways states are required to meet environmental standards. So yeah, and so look for those fact sheets on the recommendations. You can Google Union of Concerned Scientists, Cumulative Impacts Recommendations to EPA, and you'll find them real fast.
Thank you. Yeah, the fact sheets are super helpful. Thank you for creating them, Kristie. I think it was the last theme. One of NEJAC's most resonant themes reads, EPA should validate lived experience and incorporate it into assessments and processes through co-design and shared leadership. What does lived experience mean to you? And how can agencies elevate that wisdom alongside quantitative data? And what might it look like to measure improvements in lived experience over time?
Yeah, so I talked about that example, I think in my first response a little bit, where we were in an information session or I might not have talked about it. I talked about the information session, but someone was pointing out where people live and where elderly people live. And that is lived experience, and that informs how we do an analysis, where we put measurements, where we might estimate pollution concentrations, et cetera. So the lived experience can look like a lot of things. It can look like a simple conversation where someone's words and their description is put into a report so that maybe the numbers and the other qualitative information is lifted up and made more kind of realistic or grounded in people's actual observations. It can also look like more formal conversations with community folks and who are experts, talking about where they experience a facility being on or off or working, or where they might experience odors and visual cues of where pollution might be, and using that to inform where measurements are taken. It can also be, having those conversations, and say you already have measurements, and breaking out those measurements into different people's quotes, to look at, were you measuring in the right place even? And what does that number that might, it's really hard to maybe understand what a number 4 might mean, but you kind of make it a little more illustrative by having someone's quote explaining what that number 4 might mean. Furthermore, it could mean a community doing their own measurements, deciding based on their expertise where measurements should be taken, etc. One thing that I think we've all seen as far as is lived experience and incorporating lived experience, and it's a great visual for what this is, are when you see a bunch of people in a picture, a photograph, standing around a really large piece of maybe poster board or something like that, and everyone's pointing to different locations in a community mapping exercise. And then those where and that what from each of those community experts is digitalized into a map. That's another way of incorporating lived experience. So it's all really important. And one thing that it goes without saying is that this is expertise. Communities have expertise about the ins and outs of where they live, and this expertise needs to be compensated. And before I stop answering this question, because it was a theme throughout all of our recommendations, but it's important to think about the connection, the stems, and the connections between the words expert, experience, expertise. And we need to all carry that around so that lived experience continues to be elevated in these cumulative impact assessments and not belittled, that it's elevated and included and respected, etc.
Thank you. And on that line of lived experiences, kind of shifting the focus towards race, why is an explicitly anti-racist framework essential for cumulative impact work? What shifts when we name structural racism as part of the problem rather than treating it as an inequity or as a coincidence?
Right. This is a great question and foundational, fundamental in this work for sure. And there's lots of different ways and people who would respond to this question. And so I'm going to acknowledge how I will respond to it, which is as a scientist and not someone who has lived experience. But that said, one of the reasons that I see cumulative impacts requires an anti-racist lens is the overwhelming evidence of communities of color being more exposed to pollution of all kinds, air, water, soil, than other populations. We as as a world and as our country have known where downwind is for a super long time. And knowing where downwind is means that we know where people can live to avoid being downwind. And the fact that people of color in low-income communities are predominantly downwind from factories, industrial centers, etc., did not happen by accident. These were policies such as redlining, discriminatory loan practices, blockbusting, etc., that intentionally place low income and people of color in places that were downwind of these industrial facilities in our country. And so to correct this, we need to continue the work of environmental justice to ensure that, people have fair access to environmental protections and people have fair access to participate in governmental decision making. And I will say now that the NEJAC is one way to really lean into participating in, governmental decision making. You're not just commenting on one thing, which is really important. And it's important to be able to do, but you get to go and learn and dig deep and understand a situation and really participate in that government decision making in these federal advisory committees like the NEJAC. And so my last thing I'm going to say here to answer this question is, despite recent federal rhetoric, environmental justice work and initiatives are legal. So the Union of Concerned Scientists just had the honor to have Marianne Engelman-Lado write a blog post for us on the legality of environmental justice initiatives. She was Deputy General Counsel at the EPA before this calendar year and is now a research scholar at NYU School of Law. The blog post is on the Union of Concerned Scientists webpage. If you Google Marianne Engelman-Lado and Union of Concerned Scientists, you will find that blog post, and it's worth reading and sharing.
I'm so glad she shared her thoughts with the public that way. So last question from me. Cumulative impacts can't be solved by EPA alone. Where else do you see opportunity? What roles can philanthropy, state governments, academia, and local public health agencies play in carrying this work forward?
Yeah, so much of the folks who used to work on cumulative impacts at the EPA, either as scientists, coordinators, environmental justice experts, have had their jobs eliminated in this administration. So there's a lot of need for formal structures outside of government, federal government right now, to step in and continue and progress this work. Communities and agency staff, like state and local municipality agency staff. So I'm going to repeat. So just communities and then state and local municipality agency staff are writing rules to implement cumulative impacts laws right now. They're writing bills, they're going through language, they're trying to figure out analyses and processes, and they need space and support to do that work. So the regulatory rules and processes protect people. And so that means spaces maybe to share lessons learned, because now we're talking about states needing to talk to each other and cities needing to talk to each other. And so they need spaces like I said, sorry, I'm repeating, but share lessons learned and think out loud. Because sometimes a phrase that you might write into a rule could be interpreted different ways. And you want to ensure that it's interpreted in the way that the community has stated they need and have observed and experienced that they need. So academia can support some of these connections and provide formal, these formal spaces for that to happen. And foundations can do that, and they are doing that, doing that work of creating these formal structures outside of the federal government to keep this work progressing and continuing. And all throughout, we need to just continue to ensure that communities and community voices are included. The people most impacted by these laws and rules are included and held up and have a big say in how cumulative impacts is both assessed and considered in decision making.
Thank you.
Yeah, thanks.
So before we close, Kristie, what's one next step you hope our listeners take away, whether they're policymakers, health professionals, or community members?
Yeah, so I will close by saying that cumulative impacts is a solution-based process to reducing pollution in overburdened areas and reducing the disparities or the inequalities of pollution exposures. So I love spatial analysis, making maps and looking how data might vary across geographies, how different data might overlap. But I feel like cumulative impacts, that umbrella, the concept, the science behind it, pushes those impact maps past just reporting out the impacts to decision making, to be incorporating in decision making. So we aren't, again, just reporting out the impacts without doing anything about it. And I think cumulative impacts is giving us that process and that science and that umbrella to be able to move what we keep seeing in the data into decision making, into action, to hopefully get these outcomes, to again reduce pollution and overburden communities and reduce those gaps between communities' pollution exposures. Yeah, thank you.
Yeah, thank you so much. So you can read the full NEJAC Cumulative Impacts recommendations and explore supporting fact sheets on the Union of Concerned Scientists website. As Marianne Engelman-Lado reminds us, environmental justice isn't radical, it's common sense fairness. It's a promise of clean air and clean water for all, made real through data and lived experience. Thank you, Dr. Ellickson, Dr. Kristie Ellickson, to our partners at UCS and everyone listening for helping carry this work forward.
Thank you so much.
Thank you for having me.
Yeah,
thank you for having me.
Great. Thank you.